and see what comes up.
Yeah, Dr. Laurence, just some came in to the host that you might not be seen, but can you explain your injected anesthesia in more detail? Basic blocks aren't covering everything.
Sure. Yeah, along the periphery of the face, you're always going to be really spotty. And so all the callers on this call are familiar with blocking the 3 branches of the fifth nerve, and you know how to do that. We always block those fairly aggressively. I mean, I know that really, really good blockers can use a half a cc to a 1 cc and really get a great block on your region of the face. I'm not as good, so I start with some lidocaine without epinephrine just to make sure they don't feel quite as much of a burn. There's a little bit of ice first, actually a little bit of topical anesthesia before that. So here's how it goes. Topical anesthesia, ice, 30-gauge needle with plain lidocaine to just numb up the skin. And I might even put it a little bit deeper. Then my workhorse is my lidocaine with epinephrine that I inject right down on the periosteum where the nerve is penetrating through. And if I don't get a good block from there, what I usually do is some double strength clients. That would be a 0.01 lidocaine with 1 to 200,000 or so epi, and we'll actually do a little bit of a regional or senescent type of block. Anywhere where the patient's feel anything, we'll go in, and if we have to put in, you're not going to run into any safety issues with using as much volume as you need to. If you limit your first block to about 10 to 15 cc's of 1%, and then use as much double strength lines as you want to around the hairline where sometimes they're sensitive or otherwise in the periphery. And just be patient. I've seen a lot of my colleagues do this without a single assistant. They just do the laser, patient feels something, they put the anesthesia in, wait a couple minutes, and go. I don't know what your time is worth, but this is a very high dollar procedure. And if you have to sit there with the patient for 3 hours lasering, because it's what you love to do, and making sure they're anesthetized, there's all kinds of other things that you can do to help patients relax, whether it's an oral cocktail, whether it's nitrous, which all of our dentist colleagues have learned to use very well. There's a lot that you can do to kind of get patients comfortable. The main problem with nitrous is that a lot of times whatever delivery apparatus you're using will be in your way for most of the procedure. So one tip on this is I'll tend to go down into the neck area with anywhere between 20 to 40 cc's of that double strength line early on in the procedure, because the neck doesn't tend to block nearly as well. That local anesthetic down into the skin early on in the procedure, that numbness will remain for hours. So most of our patients leave their treatments in zero pain because of the block that we use and the senescence that we use. And really, at the end of the day, the picture that I showed you of my esthetician, she had literally zero pain during the entire post-operative course. It's quite amazing. Some patients will have some burning, especially when they apply their topical or where they wash their face. But really, the discomfort doesn't at all is anything like what the patient looks like. Very minimal.
I'm sorry, Dr. Laurence, did you see the question in the Q&A box? There's some interest in you discussing more about acne scarring, the scarring treatments, and do you do any cutting of the scar edges?
Yeah, great question. I think I can actually open up this box and I can see those questions come in a little bit better. Thank you for everybody sticking with me. I don't think we've lost a single attendee, so awesome. Let's see. So I am, let's see, chat. Here we go. Okay, so for acne scars, That's an art. There's a lot of different ways to do it. We all know that acne scars that are more saucer-like do way better than acne scars that are ice pick type scars. So what I can tell you is when you have this patient with saucer type scars, they will do really, really well with aggressive Mixto by itself. And you may need to be doing about 5 passes on this area, but usually you're talking about an area no larger than a baseball on the cheek, and you're kind of feathering off of that. I would usually try to convince those patients just to go ahead and let me do their whole face. I charge the same. I'm so aggressive with acne scarring that I just really can't see doing it for anything different than what I usually do for a full face resurfacing. And so hopefully they've got other skin issues because that's going to be a bonus. I'm going to have to feather off of it anyway. That's going to completely take care of, half to 2/3 of the face anyway. So I do 5 passes, and I'm going to do a combination of the deep 30-watt 10%. I might even in an acne patient do 2 passes at 30 watts at 10%. And then I'll do a pass or 2 of 20/20, and then a pass of 10% at 40 watts. I'm sorry, at 10% at 40% at 10 watts. And so you want to kind of layer that treatment. You want to be really aggressive with it. I've been surprised how many patients I did not think needed subcision, and I made a little nick in a little natural crease pre-auricularly, and I placed a probe or something under the skin and kind of lifed those scars, those adhesions, and that really, really helped my laser. So I know a lot of my colleagues have got some little cool instruments that they use to life scar adhesions. I've never gotten one of those. I keep trying to figure out where I can get one, and so I sort of use any number of different ways to do it. I usually make a little incision right in front of the ear and just just go underneath the skin and take down those scars, similar to if I was doing a facelift. And I've got a question about a patient with that's a Fitzpatrick 2. I'm treating their whole face. I'm treating their neck. Can I go over settings again? Start more conservative, maybe even than what I'm saying. But I'll tell you what I do in a typical Fitzpatrick 2. That's a dream patient because a lot of your 1s don't have as much dyschromia, so you don't have as much improvement to give them. Once you start getting to 2s and 3s, if they've got some nice dyschromia, they're going to see a beautiful result. They've, of course, got a lot of photo aging going on. And so I'm in general terms, I'm going to think about doing about 3 passes on that face. You don't have to do it that way. But if I'm going to take the time to get them really well anesthetized so they can tolerate the treatment, I use a 30-watt 10% pass in general. I'm going to use a 20/20, and I'm going to use a 40% 10-watt pass. And just putting those together, it just seems to treat the skin at several different depths, and it just is a good workhorse way to go. Yeah, we've gotten really artistic with this. We sit down, and me and another staff member will talk through, how are we going to handle some of the little fine details. And we get really picky about little things in the face that we want to address, and we do things every once in a while. But at the end of the day, our workhorse way of going across the face is thinking in terms of an aggressive treatment being 3 passes, and maybe in even some zones 4 passes. We'll add an extra 20/20 pass in if we need to. That's kind of the way we go about it. And then as far as the neck goes, again, I might could use 300. That would certainly be faster.